Over 9 million people around the world have been infected with COVID-19, a disease that has claimed nearly 500,000 lives in only 6 months. Lockdowns and other measures to fight the coronavirus have disrupted daily life and severely damaged economies. As efforts to contain the coronavirus fail, the world has been focused on finding a vaccine. But some health experts are raising a worrying possibility that COVID-19 might never go away.
I think that there's a high probability that this virus is going to be around a long time. This virus can get spread by people who don't have symptoms. So even people who don't feel sick can pass it on to others. Another feature about this virus is like some other coronaviruses like SARS or the Middle East respiratory virus, there are super spreading events. So depending on the situation, a person can infect a very large number of people at one time. On the defense side, one of our main defenses is vaccines, but we don't have a vaccine right now against this virus. And so we're relying on different public health measures like travel control, distancing, personal hygiene. But these kinds of measures are hard for people to keep up. When people start not applying them, then it just means the virus has a chance to go from one person to another, and so it will pick up in activity again.
When it comes down to the vaccination, everybody talks about this wonderful herd immunity. But the challenge with that is that even though we may be able to have vaccination and everybody can be vaccinated, in the elderly, they may not develop as good an immune reaction or immune response as in the younger people. So they're still going to be susceptible. If you look at from history, we have influenza, which we have good vaccines for. The vaccine uptake is still not as great as one would like because the coronaviruses are like the influenza viruses. There's still the possibility that over a number of years, there may be small mutations or changes in the antigenicity of the virus, which means that this coronavirus may slightly change and the vaccine may no longer be effective. The virus is not going to go away. I think most people now recognize is that it's going to be like the other coronaviruses. It's going to be around in the world and most likely after this first big outbreak, we'll have a seasonal influence. You'll be getting small outbreaks. The virus will ping pong between the northern hemisphere and southern hemisphere.
While many countries are still struggling to limit the spread of COVID-19, a few have set an example of how local outbreaks can be brought under control.
I think we have several models of what can work. If we go to mainland China, they had huge numbers of cases and then made a huge effort to bring it under control, and they were successful. But it was pretty costly. They had to have big lockdowns. In Korea, we saw it started off with an explosion of cases, but by implementing strong control measures and a lot of things like electronic monitoring, they were able to bring it down. I think Hong Kong is a really good example of taking a middle road. The government and the public were really serious from the beginning. They've applied a number of control measures like travel control, distancing, and they've also combined it with monitoring the situation really well, and then adjusted the control measures up and down. I think it's a good middle-of-the-road approach that a lot of other countries could take a look at.
Some view the pandemic as not only a public health crisis, but also a catalyst for change, creating opportunities that will shape our future.
COVID-19 have impacted everybody, but in different way. A lot of the companies that we look at and invest in, if you're in online education, online dating, online gaming, anything sort of like facilitate sort of the virtual experience, they're doing great. This crisis in many cases accelerate a lot of the adoption. I can tell you a lot of the American banks and hospital, the system is still run on mainframe. And this is built 30, 40 years ago. And the resistance is really coming from inertia for change. And now you can't afford not to change because of this crisis to force all of us to rethink how we need to change to survive.
I think the new normal is open to a lot of speculation. None of us can clearly see what the future is going to be like, but I don't think it's going to have much to do with the virus itself. I think new normal really is going to have more to do with how we as people, we as societies are adjusting to this current situation. I think that what COVID has done is opened up everybody's eyes about we don't necessarily have to do things as we did it in the past. And there will be many different choices made by different countries, different companies, individuals, and all of that will reestablish the new normal.